Spray will be gone from flu vaccine lineup this fall. Wilmer, Minnesota. When clinics and other health providers roll out their influenza vaccine this fall, there will be a gap in the lineup. Flu Mist, the spray version of the flu vaccine, has been pulled amid new research indicating that it's losing its effectiveness. Armed with this new data, an advisory panel to the U.S. Centers for Disease Control and Prevention recommended in June against using it during the upcoming flu season. Health providers say they are following this advice. "We won't be offering the mist," said Ali Lesteberg, infection control and immunization lead registered nurse at affiliated community medical centers in Wilmer. Family Practice Medical Center in Wilmer is taking the same action, as are most other organizations that provide the flu vaccine. It's a big switch from what the public is used to. Overall, only about 8% of the influenza vaccinations given annually in the U.S. are the spray version, the rest are the traditional shot. But after Flu Mist was introduced in 2003 for use in healthy children and adults aged 2 to 49, it quickly became the vaccine of choice for this age group. In fact, it was recommended 2 years ago as the preferred option for children from ages 2 to 8. The abruptness with which the spray fell from favor came as somewhat of a surprise to many. "It's a total change," Lesteberg said. Providers have been quick to adapt. Most had already ordered their flu vaccine supply, including doses of Flu Mist, earlier this year. They are responding with new game plans to ensure they will be ready to start offering flu shots, minus the spray, this fall. "We've readjusted our order," said Stacy Zondervan, clinic manager at Family Practice Medical Center. "When the vaccine comes in the door, we'll make that available." All of the 35,000 doses of flu vaccine that ACMC expects to administer at its clinics during the upcoming flu season will be the injectable version, Lesteberg said. ACMC also will offer Fluzone, a high-dose vaccine designed for adults 65 and older, she said. With 4 times the antigen of a standard flu shot, Fluzone is meant to boost protection for older adults, whose immune system tends to wane with age. It's not clear why Flu Mist is losing its ability to protect against influenza. Formulating the flu vaccine each year involves some guesswork about which strains of the virus are likely to be circulating, and in some years the vaccine simply isn't a good match. The decline in the effectiveness of the spray in the last couple of years has not been matched by a similar decline in the effectiveness of flu vaccine injections, however, leaving researchers puzzled as to why. The traditional flu shot was 63% effective in children and teens during the 2015-16 flu season, while the spray was only about 3% effective, according to a data review by the CDC's Advisory Panel on Immunization Practices. The manufacturer of Flu Mist has disputed the results, saying its own studies found the spray was at least 48% effective in 2015-16. Researchers are trying to figure out what's behind the apparent decline in the spray's effectiveness and how it might be fixed. Meanwhile, local health providers hope the absence of Flu Mist won't discourage people from getting a flu shot this fall. "It's going to be a big difference, but you want to get the one that works the best," Lesteberg said. Annual immunization against flu is recommended for almost everyone over the age of 6 months. "It's an important thing to protect against," Lesteberg said. Zondervan encourages those with concerns to talk to their medical provider. "Flu shots aren't something to fear," she said. "It's a couple of seconds. We do it fast and easy.